Even the most skilled massage therapists can miss the mark when it comes to treating pain effectively. And often it's not because their hands or their technique is not good. I'm Dr. Ben Benjamin, and in this video, I'll share the top 5 mistakes massage therapists make when treating pain. And more importantly, how to avoid them so you can deliver the best possible care to your clients. The first mistake that a therapist makes is they think that the client will be upset if they take time to do an assessment. They're never upset. They really love it when you figure out exactly what's going on. It tells them that you know what you're doing. Second, the problem is that people treat the wrong structure. If it hurts somewhere, they work where it hurts. And oftentimes, it's not injured where it hurts. So for example, if it hurts in the arm, it could be the neck, it could be the shoulder. It's actually rarely that you have an injury that's in the middle of your biceps or triceps. It's usually the neck or the shoulder that's injured that's referring pain. So that's a big mistake that people make. 3, they forget to tell the client that they need to come twice a week, maybe for a month or so. Because if you don't come more frequently, the scar tissue just returns and they're not going to get better. So I remember I had a wonderful student. She was terrific. When she graduated, she had great hands, great skills, but she came to me and she said, well, nobody's coming back to me. And she asked me to give her a private lesson, which we did in my school. And I said, well, do you tell them to come back, a couple times a week or once a week? Whatever. She said, no, I don't tell them. They should, I thought the work speaks for itself. She made a huge mistake. The client wants you to give them information about how to make the work most effective. So just by telling them to come back once a week or whatever she was working with, she's had a full practice now for 30 years, seeing 25 people a week. So she's been a great success because she didn't make that mistake anymore. Number 4, people don't work long enough to break down the scar tissue. It takes 8 to 10 minutes of working on the scar tissue in order for you to break it. It's been there a long time, and so it takes a bit of time for you to break up those fibers. 5, people don't suggest people do exercises to keep the scar tissue from returning and building strength. The exercises have 2 functions. One is so that the scar tissue doesn't come back. Now, as the person leaves the office, their scar tissue is starting to return, but it's in the consistency of a cobweb. You can just swat that away with your hand. It's not very strong. So if you do very simple exercises, the scar tissue doesn't return. But of course, you also want to build strength, because if you've had an injury for any length of time, even a few weeks or a month, you're going to be losing strength. Strength in the muscle, strength in the tendon. So you want the person to do special exercises that target that particular issue. And if they do that, they get the treatment, they get well. If you want to learn how to treat all the injuries in the body, join Anatomy in Action. Get yourself a subscription, and you can learn everything about the assessment and treatment of all the major areas of the body. And you can also join me once a month for a Q&A session if you have any questions or difficulty understanding a particular case or a particular injury, etc. So I hope to see you there.